Sir, when should I go to a maxillofacial surgeon instead of going to a dentist?
We are also known as facial orthopedics because any bone in the face regarding starting from orbit to the skull bone to the upper and lower jaw, everything is treated by the maxillofacial surgeons.
Sir, how do we correct jaw alignment? So, what are the steps basically involved in this?
The patient can come because of this, maybe because of function, that he is not able to chew properly. The jaws are aligned in such a way that whenever he wants to bite, the cheeks get in between and get hurt with that.
Good morning, everybody. Today we have with us Dr. Ravi Bagaria, Oral Maxillofacial Surgeon, who is very renowned in Kolkata. And today, sir has come to Vitadell to brief us on maxillofacial subject. Welcome, sir, to Vitadell.
Thank you for having me here. So, good morning, one and all. I'll be answering few of doubts regarding the specialty of maxillofacial surgery.
What do maxillofacial surgeons treat, and what are the types of surgeries which they actually perform?
Okay, so maxillofacial surgery is a branch of dentistry where we are trained to do a simple surgical removal of tooth and all the way to fracture of the jaws, cysts and tumors of the jaws, even cancer of the face and the mouth, and reconstruction for the same. Temporomandibular joint, the joint which we have in the face there, so treating the joint disorders, as well as clefts in the newborn or the adult patients. So it's a very vast specialty where we can cater to all the different problems as and when required.
Sir, when should I go to a maxillofacial surgeon instead of going to a dentist?
Okay, when you need a specialized consultation in any of the problems which I mentioned earlier, like where the tooth need to be removed surgically and you need a minimal or the no complication scenario, then you should visit a specialist. And as I've told about the jaw fractures, we are also known as facial orthopedics because any bone in the face regarding starting from orbit to the skull bone to the upper and lower jaw, everything is treated by the maxillofacial surgeons. So any of the requirements regarding the surgical removal of tooth to the jaw fractures due to accidents and jaw corrective surgeries, or burning sensation in the mouth with the lesions in the mouth, can always visit a maxillofacial surgeon.
Sir, how do we correct jaw alignment? So, what are the steps basically involved in this?
Okay, so correcting jaw alignment is, we can divide it into two. The patient can come because of this, maybe because of function, that he is not able to chew properly. The jaws are aligned in such a way that whenever he wants to bite, the cheeks get in between and get hurt with that. Or socially he is not feeling, or she is not feeling confident in facing the society, so where she wanted to correct aesthetically. Functionally she is fine. So in those scenarios, what we can do is we can always come to a maxillofacial for the corrective treatment for the same.
Sir, what are the signs that one needs a jaw corrective surgery?
Okay, so basically I told you, functionally if there is a compromise, like the patient jaw is small, that is not able to bite, or aesthetically the jaw is deviated to one of the side, maybe the right or the left side, or it is very much engrossed and it looks like a bird face deformity for the patient. So in those scenarios, and you can do a self check at home where you yourself will be knowing how your teeth are getting into the position when you are chewing. So that is a simple way. When you feel that you have a very prone to getting cheek bite or the tongue bite, you are very prone to having open mouth. Maximum of the time the teeth are not closed or the lips are open in a rest position also. So in those places, if a patient always have a open mouth, you actually lot of bacterias and dust into the mouth lead to your periodontitis or the gum inflammation a lot, and you slowly develop a habit of mouth breathing also. So those are the signs you can always do at home and come to us then. Sleep apnea, as you told, it's known as OSA, obstructive sleep apnea. Means when a patient or when a people is sleeping, they cannot breathe properly due to some obstruction. That is known as obstructive sleep apnea. So these conditions either happen because of the anomaly in the nose for breathing or in the structure of the mouth.